Hello and welcome to Trait Talking, the first episode of 2025. As ever, I am joined by FitnessGenes co-founder and Chief Scientific Officer, Dr. Stuart Grice. Dr. Grice, welcome. Happy New Year.
Yeah, is it late? Is it too late to say Happy New Year? I guess it's
we're about 2 weeks in and we haven't seen each other multiple times, so perhaps it is. But I haven't asked you whether you've had any, or if you've got any resolutions yet.
No. Work hard, keep reading. That's about it, really. Try not to die.
Excellent. Well, hopefully that third one you see that through all the way. But yeah, so as we kind of announced in our last episodes, the science team are currently taking a short break from the development of reports to focus on other priorities and other releases that are coming in the next few months. But that doesn't mean that we're short of content. Drawing on Dr. Grice's expertise, we've got plenty to discuss over the coming months still. And today's the first one of the year is quite a challenging topic, actually. This is something that we were discussing yesterday, and it's really questioning whether there are potentially detrimental effects to exercise. We all know that sort of health and fitness and longevity are dependent on improved body composition and things like VO2 max and relative strength and that type of thing. But it appears that for some people, certain intensities of exercise is actually increasing their risk of certain conditions. So Stuart, this is something that you and I were discussing in the office yesterday.
Sure.
And yeah, we'd love to sort of know more about it as well.
Sure, I think it's a good point to just separate it from kind of the sensationalist piffle you obviously get on the internet, where something's bad, something that's good. We know exercise is incredibly good and a great modifier of many chronic conditions. But this actually stems from kind of my old role at Oxford, where I was looking at motor neuron disease. And I think it was at the beginning of probably the beginning of the last decade, so probably 2010, where I was at a conference and talking to the professor of neurology at Oxford, and he was saying for people with a condition who develop a condition called motor neuron disease, intensive exercise may actually increase the risk of getting the disease. So it's a complex disease with many environmental or genetic interactors, and I guess he goes to the clinic. He was starting to see people presenting in the clinic with amyotrophic lateral sclerosis, which is motor neuron disease, that actually were people who engaged in intensive exercise. So I guess this set a lot of questions within the subject area, excuse me, and they started to do many studies over the next decade looking at whether exercise was actually partaking in physical activity was a risk factor for motor neuron disease.
Okay, so as someone who does a lot of exercise, this seems quite alarming, but just to take it a step back, so what specifically is motor neuron disease?
So it's a neurodegenerative disease, and it's fatal, but unlike conditions like Alzheimer's and Lewy body dementia and the dementias, it is not a cognitive degeneration. So with dementia, you have a degeneration of cognitive abilities. It's actually degeneration of the motor neurons, so the motor nervous system. So these are the neurons, there's kind of upper and lower motor neurons, but they're the neurons that innervate the muscles. And then, so when you consciously want to move, when you go lift a weight, when you want to pick up a cup, these are the neurons actually innervating and driving the contractions for your muscles to act. So within motor neuron disease, these neurons degenerate. You start to get stiffness in the short term, and over the time you get muscle weakness and different muscle groups. So there's a broad spectrum of motor neuron diseases. We're specifically in talk about amyotrophic lateral sclerosis in this one. So this is the condition originally called Lou Gehrig's disease, famous baseball player who presented with it. Now there's been a debate whether he truly had ALS, but let's just move on from that. Stephen Hawkins, who famously had it, the famous physicist.
And also recently Rob Burrow, right? And
yeah,
all the work that's been done to sort of raise funds around that foundation.
Exactly, and this kind of leads in quite well that there's a significant number of people who are professional sports players that are now presenting with motor neuron disease, with ALS specifically. Now, of course, we can sort of tease through what that means at the moment, because there's a physical activity, and then there's the trauma of, well, particularly with, he was a rugby player, head contacts, concussions, everything else that actually are also linked to certain types of neurodegeneration. But as we go through kind of the disease itself will start, I think we're going to start to see that actually it's the physical activity component and the intensive physical activity component that's actually the significant driver of, or sorry, the increasing risk factor associated with people engaging in sport.
Okay, so just going back to the condition, sort of how many people sort of typically develop motor neuron disease, and what causes it? Okay,
so I think the lifetime risk is about 1 in 300 to 1 in 500. So there's 1 in 300 to 500 people will get it.
That's still relatively high.
It's relatively high. Now, if you look at the sort of the current prevalence, that's you're looking about 10 in 100,000, like 5 to 10 in 100,000. That's because it's late onset, and it's also when you get it, it's fatal, so you die quite quickly. But in terms of lifetime risk, it's about 1 in 300 to 1 in 500, depending on the population. Men generally tend to get it more than women. Now, is that a sex-specific mechanism, or is it the fact that they've partaken in, for example, more high intense sport over the periods of time that these people are now presenting? We don't know. 1% roughly carry genetic risk factors, and there's a significant genetic contribution. I think 1 in 10 of the cases is familial. There's quite rare variants associated with it. But a lot of the cases are known as sporadic, and what you're really seeing here is you've got polygenetic risk, or you're carrying certain genetic risk factors, but there's lots of environmental risk factors. So mechanical and electronic trauma has been perceived to be an issue in the past. Military service, now that again could be stress, it could be partaking in lots of physical activity. High levels of exercise is a big risk factor, and then exposure to certain chemicals, so one seen in agriculture, heavy metals as well in industry. So these are the general risk factors. Again, a little bit around smoking as well, of course. Less so in terms of the metabolic conditions. I've seen like obesity and stuff doesn't seem to be massively a driver of risk. So it's a complex disease. Genetic factors and environmental factors, and I think from the majority of people that get the disease, it is a genetic environmental interaction, I think.
Okay, as with a lot of things that we look at.
Well, yeah, for sure. Yeah.
So just going back to those risk factors, obviously exercise is the one of interest to us today. In terms of when we're talking about high intensity exercises, as you touched on, what does that look like? Are there certain types of activities that are increasing that risk to a greater degree?
Sure. So I think there's been a progression of studies, obviously small observational studies, to incredibly large cohort studies, and some more controlled Mendelian randomization studies, which we'll touch on slightly in a minute. So that the major sports that people have been looking at are like things like football, American football, and one big cohort was cross-country skiing. Now, I think let's just step back at the moment. We sort of alluded to that head trauma, significant exhaustion, and cardiovascular events are also linked to death and negative effects in sport. And we can particularly think about rugby players having head traumas. Now, there have been separate studies with ALS, motor neuron patients, looking at the number of concussions in certain cohorts versus the likelihood of getting ALS, motor neuron disease. And actually, there doesn't seem to be a huge link between the actual trauma, the physical connections, contacts that are occurring in these sports to the risk of the disease. A particularly interesting cohort is the cross-country skiers, because these don't take a lot of drugs. They're not, I guess there's sometimes they can be falls, but generally they don't have the physical contacts that you'll get in football, soccer, the other side of the pond, and American football. And there's for the people that are partaking in lots of cross-country skiing, so the semi-professional, the very enthusiastic amateur, and obviously the professionals, there's a fourfold increase in risk of getting ALS in these groups. And I think this is a very interesting cohort, because cross-country skiing is at a point of where you've got a sustained aerobic energy turnover, but also you have repeated work that sometimes will take you over your VO2 max, I guess, so your peak. So that's obviously anaerobic. So that it's starting to point to actually a particular type of exercise is the exercise that actually is in high intensity. So there are no studies on HIIT, there's no studies on CrossFit, there's no studies on the new high
high rocks.
The high rocks, I nearly said hyrax, which is obviously an animal, high rocks. So there's no studies on those cohorts, but this is where it's kind of alluding to these individuals that actually or are partaking in this on multiple occasions per week are increasing their risk. Then there's a large biobank study that was looking at, I think, between 300 and 400,000 people that was identified that frequent leisure time strenuous activity. So again, these are people partaking in the cross-country skiing type stuff, but more importantly, this is the UK, it'll be the football, it'll be the rugby, it'll be the high intensity exercise bouts that actually are increasing their risk. Now, of course, there's lots of co-founders in these population groups, but the study that looked at the biobank study also did what's called Mendelian randomization. We're going to do a podcast that explains this in more detail, but what you do instead of looking at a particular group doing a sport, you look at people who are genetically liable to be habitual exercisers, so it's heritability. You can genetically predict people who are more likely to exercise lots and lots, and these people with this genetic background are also at higher risk of getting ALS. So this is a way of removing the confounders to actually build confidence in the statement that people are more likely to habitually exercise at higher intensities, are more likely to get ALS. So there's that body of evidence there that's suggesting that actually intensive exercise is a risk factor of getting ALS. And interestingly as well, when we were talking about the anaerobic sort of cross switch in the exercise, that it's the type 2B fibers, so the faster fibers that are more sensitive to degeneration, at least at the early stages. So this is suggesting there may be a mechanism in the way the body adapts to the exercise that may be leading to the sensitivity of these individuals, increasing the risk of getting the condition.
Okay, I mean that's all rather interesting, because I mean we don't usually see exercise as being a risk factor for disease, right?
Mm-hmm. For sure, yeah.
So and just to go back to that point that you made, sorry, I should have picked you up on a second ago, but did you say cross-country skiers had a 4 times higher likelihood of developing motor neuron disease? Because that seems quite startling.
Yeah, and you've got to think of the relative to actual risk here. Again, go back to. This is a relatively rare disease. If you got think about lifetime risk, and that 300 figure is based on a one cohort. But if you've got 300 people in a room, 299 people are going to really benefit from increasing the intensity of your exercise within the healthy remit. One of them may be sensitive to getting a condition. So let's put it in the context of reality. Exercising really important, but this really then starts to, again, what we talk about, unpick the idea of personalization. That for this small cohort of people, this is starting to think about how you prescribe exercise. So it's not necessarily about removing exercise. So if you look at the cross-country skiers, the people that were recreational and did it at the weekends and did it keep fit had no increase in risk. It was really looking at the people who were doing it as a more intensive sort of part of their lifestyle. You're talking about the very enthusiastic amateur to the professional level. So I think that context is important, and I think on multiple papers the data is showing it is for. And again, there's horrible sort of irony here where you've got the people who are really trying hard to keep fit potentially are the ones in this small group, of course, that may be increasing their risk of getting motor neuron disease.
So on that point of personalization, then actually using genetic testing as a screening tool to identify people who carry these particular gene variants associated with this increased risk could allow sort of FitnessGenes to make recommendations in terms of the types of activities that they do to help mitigate that risk as well.
Sure. So let's kind of unpack a little bit more about this. So, because I guess in terms of how this is called, I guess the first thing you got to ask is, because it's a complex disease, so why is this happening? So you think about any acute and then extended through chronic bouts of exercise is what happens. So you get your hypoxia, you get your oxidative stress, and you get your inflammatory processes. And then how you get your metabolic stress, your acidosis that we talked about in the lactate podcast earlier at the end of last year. These processes, they're obviously due to the stress of exercise, but they become signaling molecules, that drive adaptation of the muscle to repair and grow, and the cardiovascular system and the mitochondrial function improves. You get angiogenesis, more blood vessels. So you've got these signaling processes that then drive adaptive response to exercise, and this is very healthy and important. Now, I guess what you're seeing at the moment is in ALS is the belief that actually the mutations with genetic mutations that are seen that increase risk actually impacts this adaptive process, and stop the, actually, well, you still get the adaptation, but actually you're not mitigating some of the negative effects. So actually we know hypoxia, oxidative stress and inflammation are technically negative, and there are mechanisms for reducing the negative impact on that. So one of the genes associated with getting ALS is SOD1. There's a rare mutation is superoxide dismutase, which is one of the classical antioxidant proteins. One of the most prevalent mutations, and again, as you pointed out, these are variants that you can actually look for, which is C9orf72, which is not very nice, but it's chromosome 9. There's an open reading frame on chromosome 9, and this is actually associated with vesicle trafficking. So you have little vesicles that transport up and down the neurons that actually bring the neurotransmitters, torque signaling, which is mTOR, which is very much around the growth of muscles afterwards, and a lot of these processes that actually are positive, that within ALS these may have been affected. So I think this is quite an interesting component of actually, so the first thing is, how is this actually happening, because it seems counterintuitive. So what's occurring in these individuals is when you have extreme exercise, the signaling process that is derived from the high intensity exercise that then generally manifests as a repair and grow response actually can cause damage to the motor neuron, and over prolonged periods of time, motor neuron death. And I think this is how the exercise is eliciting the negative effects within ALS, and why the high intensity exercise specifically is very important. So as you kind of point out, it's genetic burden plus strenuous exercise. The combination of them is the key. So when it comes to prescribing something, yes, I would not be worried in the general population right now. However, if you have a family history, I would look into in more detail, because again, you're looking at here that sort of recreational levels, low intensity sports, we're really talking about the high end, where the high intensity components of exercise where this may be problematic. In terms of genetic testing for ALS at the moment, they're starting to build genetic panels around this. We don't do this at FitnessGenes at the moment, but because of the sports link, we're actually looking at this. I will be looking at this over the next 12 months, I think. Technologies for particularly looking at C9orf72, which is the most common mutation with ALS. That is the variant that has been studied most in regard to the negative effects of strenuous exercise. So it is another example, as you say, of how you can prescribe exercise, and particularly be conscious of the type of exercise you're doing relative to your genetic risk factors.
Okay, so just from my understanding, it's not that we're saying doing things like cross-country skiing or playing rugby or doing high-intensity interval training is increasing everyone's risk of developing motor neuron disease.
No, for sure.
But it's potentially that combination of carrying genetic risk factors with doing certain types of exercise and certain types of exercise intensities that could be increasing that risk of developing motor neuron disease in particular individuals.
For sure, that with people with the genetic risk, the mutations seem to be impacting the adaptive process when you're doing high intensity exercise, and this is leading to damage of the motor neuron. So it is having the genetic risk. Not just if you do intensive exercise you're going to get motor neuron disease. That is not correct. You're absolutely right.
Okay, so and you said about potentially looking at these panels in the future. If someone was to sort of go through the process and find out that they carried these particular gene variants associated with this increased risk, what kind of advice would you provide them with?
So again, this is early days, and there are different, and because it's a complex disease, there's lots of modalities of motor neuron disease. But if it was me, I would probably look to shift away from doing any high intensity So the, the HIIT training, the CrossFit, the stuff that where you're switching. It's a combination of aerobic demand with small periods of then anaerobic demand. That it seems to be those sports that are increasing the risk. And again, it's because I guess what you're doing is overstressing both energy systems, and the people with the mutations linked to ALS, motor neuron disease, seem to be susceptible to when you're driving the system to that high level. And so in the future, do you see a use of this type of testing within a kind of a clinical professional setting? I think so. I know there's lab groups at the moment that are trying to. So they're actually looking at the cohorts themselves. So the different the people with the different genetic risk factors. They obviously do retrospective studies where they're trying to go, okay, how much exercise have you done? Like military cohorts are really useful when compared to sort of civilian groups, because these are people who have quite highly prescribed exercise routines. But yeah, I think. In terms of the research body, where I'd go now would be to dissect the different genetic etiologies, so different mutations. Now, what I would suspect is the mutations are probably different components of the adaptive process, and of course that these mutations have more broad effect to the body, but I think some will be highly penetrant in the fact that actually they impact the more broad adaptation process. Some of the mutations, some are not necessarily rarer, but mutations that have a lower penetrance, so increase the risk less, actually maybe in small components of adaptation. So it could be in the hypoxia, transient hypoxic environment, how it responds to that. Oxidative stress, inflammation, so there's some of the variants associated with inflammation, and then there'll be ways of maybe thinking about how you deal with the individual on a sort of genetic basis. So there'll be different genetic cohorts that sit within the disease. So from a research point of view, I think that'll be really interesting. But generally, for where we are today, if you have a family history of ALS, I would not necessarily think lots of intensive exercise will be good for you. I would very much suggest doing low intensity exercise. Okay. So I've got a track session this evening, interval training, and it's very cold outside. Is that enough of a reason to sort of bail out of that, or no? I'm afraid not. No, I think it's highly likely that, well, I say it's highly likely that's going to be beneficial for you. I think the partaking in exercise, I can't let you know whether tonight's going to be positive or negative for you. But for sure, yeah, it's again, let's not sensationalize this. Exercise and higher intensities of exercise, if you can perform them, of course, because there's other things we haven't talked about in terms of age and everything else. But we're assuming here, if you're healthy, you're young, and you can partake in vigorous exercise, do it. However, as we talk about a lot at FitnessGenes, there are always caveats to every rule, and there's always going to be small cohorts where genetics is important in identifying those cohorts, where we have to prescribe different exercise or nutritional regimes. Yeah. Excellent. Well, I mean, that was fascinating, Stu. So thank you for the first instalment of 2025. Lots more to come down the line. Fantastic. Okay, have a good day. Cheers, Alex. Cheers, bye-bye. Bye.